The last 2, I'd say 3 years now, maybe, for some of us, was the time that we really saw an outbreak that took the world by storm, COVID-19. As we tried to wade our way out of the COVID-19 tide, then we had the Ebola outbreak. What is the update on both outbreaks?
We don't have any new case. We don't have any cases on admission. We don't have any contacts on follow-up. Our treatment units are empty. And today we are on day 23 of our countdown to the 42 days. However, we remain on alert. Now, in regards to COVID-19, our positivity rate is at 1.1%. We see about 80 cases of COVID every week. We don't have any cases on admission.
I know the trial for the Ebola vaccination has been pushed until January because of lack of qualifying people to take part in the trial. What is the impact to Uganda?
The protocol for the trial was designed in such a way that the vaccine would be given to contacts. Currently, we don't have contacts. However, as a country, we wouldn't want that research to stall and be put aside. So our scientists are having a discussion on how to progress with this trial. Because what we need to know is whether the vaccine can produce antibodies that can protect people.
Uganda's disease burden is topped by neonatal disorders, malaria, and HIV in the top 3. And for a fact, we lose 16 children to malaria, 14 mothers to preventable causes, an average of 46 people each day to HIV and AIDS. What have we not done right to reverse this trend?
We are seeing new infections mainly among the younger age groups, the 15 to 49 years, and majorly among the females. What we need to do moving forward is to emphasize prevention, but also ensure that those who are on treatment adhere to their treatment. Indeed, malaria is a big challenge and the mortality is high. There are several things that we have seen and we are trying to address. One of them is that whereas we distribute mosquito nets every 2 years, only 70% of the people consistently use mosquito nets. People need to go to the health facilities early when they get a fever and not wait a little bit too long, like we are seeing in eastern Uganda, where we are having cases of black water fever after malaria. Black water fever is they start breaking down their own blood cells and then pass blood in urine. It appears as Coca-Cola colored urine, and we end up with high mortality.
We still have a shortage of the health workforce, and the challenges were exacerbated by the outbreak of the COVID-19 pandemic. What is stifling the ministry's effort to increase the numbers, even when we have unemployed health workers in hundreds on the street?
Currently, we have been operating with the structures that were made 10 years ago. These structures no longer hold. They are limited in terms of specialists, in terms of numbers, but also in terms of a range of cadres.
So we have facilities like the Mulago Specialized Women and Neonatal Hospital that has been operating slightly about 50% of the expectation. And they receive funding every financial year. Would you consider it a white elephant?
No, I would not consider it a white elephant. I think the women's hospital still has challenges, but it can do better. It has challenges in terms of funding, which is not adequate to run a big facility like that. It has challenges in terms of human resources and specialists to run the facility. It has challenges in terms of marketing itself for the population to understand that such a facility exists and can provide a wide range of services. But it also has challenges in regards to management of services. So we are addressing this together with the board. Health Service Commission is committed to recruit more personnel as soon as the wage bill is increased.